Hi, my name is Rosangel Vargas, and today I will be presenting my journal article. The title to my journal article is pretty long. It's Prevention of Sudden Cardiac Death with Implantable Cardiovertebral Defibrillators in Children and Adolescents with Hypertrophic Cardiomyopathy. So I'm looking at my slideshow right now because it's a little difficult to present this way. So I added on the second slide the abbreviation, the acronyms that they provided in the journal article. I'm gonna briefly go over them. So CL means confidence interval, HCM means hypertrophic cardiomyopathy, ICD means implantable cardiovertebral defibrillator, LV means left ventricle, LVH left ventricle hypertrophy, SD sudden death, and ventricular fibrillation means VF, VT means ventricular tachycardia. So my article basically had to do with children that suffered from hypertrophic cardiomyopathy. And now I'm going to go over the objectives. The main goal of the study was to determine the adequacy of implantable cardiovertebral defibrillators in children and teenagers that suffer from a condition called hypertrophic cardiomyopathy. So I have my little notes here. So basically, what is hypertrophic cardiomyopathy? Hypertrophic cardiomyopathy is a disease in which the heart muscles become abnormally thick, and it makes it hard for the heart to pump blood. And then implantable defibrillator is a small device that is inserted into a patient, and it uses electrical shocks in order to help with the regulation of heartbeats. So those shocks will help the patient with regular heartbeats. And that's basically what the objectives are. Basically, the main goal of the study was to test these defibrillators and to see how they work on teenagers and children. It was a really interesting journal article. The background. So for background, I added a picture. I will be going over what the picture means. HCM is the most common cause of death with children and adolescents. ICDs for the past years has indicated positive results for death prevention. And I'm going to start comparing the picture I added on here in my background. So here we have two hearts. Heart number 1 is a normal, healthy heart. Heart number 2 is a hypertrophic cardiomyopathy heart. And if we look at they're also labeled. So if you look at the ventricular septum, you can tell that in a normal heart, it looks thinner. But then when you look at the hypertrophic cardiomyopathy, you can tell that it's much thicker. So, and also if you look at the left ventricle up to a normal heart, there's more space and the blood can pump easily. But when you look at the hypertrophic cardiomyopathy heart, you can see the small space that the left ventricle has. So it's much harder for the heart to have oxygen and for it to pump blood. And now I'm gonna do methods. So for methods, in the journal article, basically ICDs were implanted from 1987 to 2011 in 224 unrelated children and adolescents. And patients received ICDs for primary, so a total of 188, and then patients that received ICDs for secondary were a total of 36. and I will be going over what primary and secondary means. The study was basically done in the United States. It was also done in Europe, Canada, and Australia. So it was good that they did this study in different parts of the world, to have a good comparison. So here we are looking at figure one. Figure one is color coordinated, so primary prevention is in blue and secondary prevention is in yellow. On one side we have the number of patients from 0 to 60, and we also have the age of the age at implant in years. So children from up to 20 years old had these implants. So here we have hypertrophic cardiomyopathy, judge a high risk for sudden death, and implantation went for primary and secondary prevention. So basically, primary prevention is a treatment for individuals who are at high risk of HCM. And patients with secondary are basically intervention therapy that was undertaken to prevent HCM in patients who had already experienced life-threatening. And secondary also has to do with patients who had these problems before, patients who were resuscitated and from sudden cardiac arrest. So if we look at the chart, figure one, we can say that, for example, children from the age 9 to 10 in primary prevention had about 22 number of patients had the implant from 9 to 10 years old. And then for secondary, we can say that these children had we can say 25 in between, 25 for the number of implants. So now we're gonna go over results. So the 224 patients range from, like I said, they were from 1 to 20 years old. And 60% of these patients were 15 years of age, and 67% were males in the study. So the mean range between the results ranged between 17 years old. And then for table one, which is very interesting to look at, we have basically the characteristics to each prevention, primary and secondary. And I'm looking at it right now. You can look at the, we have characteristics, all study in patients, which were the 224. We also have the primary prevention and the appropriate intervention. For secondary, we also have the appropriate intervention and the overall. So as an example, for secondary prevention, if we look at LV, for left ventricle, left ventricle had more of wall thickness when it came to secondary prevention. And this may be, the result of this is probably because secondary prevention, we got to think about, in secondary prevention, patients had heart attacks. So it's normal for this result to come up. And then, for example, if we look at, LV and diastolic dimension, we can say that in primary, it had a bigger impact than it did in secondary prevention. So now we are looking at figure two. Figure two shows 3 different pictures. They're labeled in ABC. So this is basically like an echocardiogram, and it measures the heart rhythm. And I'm going to be explaining what each picture here is demonstrating. So for A, we can look at the way the waves are moving. A is basically picturing a normal heart rhythm or a normal heartbeat. So a normal heart rate will land from 60 to 100 beats per minute. And here we're looking at, for B, we can say that the cardiac rhythm had a disturbance. And if you look at the waves, it doesn't look quite normal. It's like it looks like squiggly lines. So the heart beats rapidly, and you can tell by the way the waves are. So doesn't look really normal. So if we look at image C, the defibrillator was used on here in order to control the waves. So what the defibrillator is doing is it's restoring the rhythm and the waves, and it's trying to make it go back to its normal beats per minute. So if we had to choose the worst one, of course, it would be B. And a normal one would be the start of A, because if you look at the third line in image A, it starts to, the rhythm starts to fail. And then for C, they start to regulate it with the defibrillator. Figure 3, we have the ICD intervention rates. For figure 3, we have the lines in red and blue, red for primary prevention and the dash lines for secondary prevention. So we have the cumulative rate of first appropriate intervention in percentages, and we also have the time elapsed after implant in years. So basically, if we look at the graph here, the chart, we can say that secondary prevention definitely had a higher time elapse. So secondary prevention exceeded when it came to the time. It elapsed a lot more than primary prevention did. So for primary, you can say that it's a little lower than secondary. Figure 4. Figure 4, we have the number of patients, and we have these bar graphs here, and we have the time from implant to first appropriate ICD intervention in months. So we had from 10 months to 90 months. So primary again is in blue, secondary is in yellow. So the time intervals for implantable cardioverter defibrillator implantation to first appropriate intervention in 224 patients. So basically, the number of patients for, let's say, from 11 to 20 months, the number of patients for primary were 4. And then if we look at the yellow, secondary prevention, for 11 to 20 months, we can say it was about 7. So we just calculated. And then from 31 to 40 months, primary and secondary had no implants to no time in implants for appropriate ICD interventions. And now we're looking at figure 5. Figure 5 is showing the number of sudden death risk factors in ICD interventions. So here we have risk factor 1, risk factor 2, risk factor 3 or more. 3 or more is in green, 2 is in blue and it's dashed, and then we have 1 which is in red. So 2 risk factors were definitely was definitely the one that elapsed the most after implants within the years. If we look at it, it's definitely going up. If we look at the number at risk, it's kind of higher than all the other ones, and the distribution was non-uniform during the follow-up period. So with early, it says interventions, it was disproportionate in here. So And then we have for discussion, basically, ICDs have made a life-changing to children, adults, adolescents. So patients who underwent the ICD implantation had a 5% per year intervention rate, which is good. So these patients um, had good results and less time going into cardiac arrest. So it looks like the ICD implantation helped them a lot. So predictions were made that younger patients were most likely to experience device complications due to physical activities. So that's kind of normal. Younger patients are more physical to activities than a 6-year-old would be. So, and then we are looking at table 2 here. If we look at table 2, it's basically talking about the primary prevention risk factors and ICD interventions in 188 high-risk children and adolescents. And we have the primary prevention risk factors. We have extreme LVH, syncope, family history, HCM related. We have NSVT and other. NSVT is non-sustained ventricular tachycardia. And we also have the number in percentages of 188 patients that underwent with the implantation. We also have the number in percentages with appropriate discharges and risk factors also. We also have the number of 26 appropriate discharges that patients underwent. So a syncope, we can use syncope as an example. Syncope had a 38% of 188 undergoing implantations. And a syncope is basically when a person loses their conscious due to a very high fall in blood pressure. So if their blood pressure falls, they're gonna lose their conscious. They're gonna get really dizzy, and they won't know where they are. They'll lose their balance. So that's basically table 2. It's just explaining the primary prevention risk factors. And then we have figure 6 here. So figure 6 is basically talking about distribution of primary prevention risk factors in patients who experienced appropriate implantable cardioverter defibrillators interventions. And if we look at the graph here, we have a percent of appropriate interventions from 0 to 80, and then we have the risk factors alone or in combination. So we have massive LVH, we have syncope again, we have the family history, and we have NSVT, and we also have hypotensive to exercise. So if we look at, for example, syncope, so they had a 50% of appropriate interventions when it came to a syncope with patients. A massive LVH had about a 65%. And I would say the lowest would be NSVT with about like a 13%. So that's really interesting. Okay, so in conclusion, the data obtained from the study in different places of the world helped with ICD decisions with patients who suffered from HCM. So the data basically helped a lot. It helped obtain many, it helped obtain data from different countries all over the world. And it also helped with decision making when it came to making a decision in young, high-risk patients with HCM. So ICDs may be required to be implanted at an early age in order to prevent any heart failures. So it is recommended that children visit their doctors, and if they find any irregular heartbeat rhythms, that they get it checked out. And then if they have HCM, it's very important that they continue the process. And if it's important for them to get ICD, it's important for them to or it's more recommended for them to get it implanted sooner than later, at an early age, in order to regulate their heartbeats and their heart rhythm. So here I added an ICD video. It's only like a minute long. It's short, very precise. It explains how the heart is, how the heart beats, and how an ICD helps the heart with the regulate with their beats, and how it regulates the heart when it comes to its beats, and the blood flow and all of that. So it's really interesting. It's a short video, but it's very accurate and precise. I liked it a lot. And that's all for my presentation. I also added my citations onto here. If you have any questions about this journal article, do not hesitate to email me with any questions. I really enjoyed the article. Thank you.